Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation.
Hello, Roxy. We are back to record our next episode. How are you?
I'm doing great. How are you today?
Good. I've been asked a couple of times from friends, like, where do you record the podcast at? Like, are you guys together in your living room? I'm like, no, I am in my office. I know. I wish we were together. I'm in my office here in Wichita and you're in Abilene and we're on Zoom. But it's always fun. Love technology, right?
Oh, yeah. Yeah.
All right. Well, today we are going to talk about constipation and pooping, which if you know a pelvic floor therapist, we love to talk about this stuff. And we just thought that this is definitely kind of a very important topic. Another one of those topics where people just kind of have been dealing with constipation for a long time and they say, well, that's just me. And they don't think there's anything that can help. Constipation affects millions of people, and it is the number one GI complaint. And it is something that we think is pretty important to kind of share a few little nuggets on, because a lot of what we know about constipation, you may not know. So when we say things like pelvic floor dysfunction, a lot of times people think we're talking just about like urinary leaking or painful intercourse or pelvic pain. But that also can mean that you're having a difficulty having bowel movements, and you have kind of this rectal sphincter dyssynergia, we call it, where you're having a difficult time with coordinating your muscles and your nerves to allow the anal sphincter to release so that bowel can come down. And that technically is pelvic floor dysfunction. So we're going to talk more about that. Roxy's going to lead us into a little anatomy review. But hopefully after you listen to this podcast, you will have a little bit more understanding about how pelvic floor therapy can help with constipation, give you a little bit of hope if you've been going to GI doctors or your doctor and you've been kind of given this, like you have IBS or you've had the colonoscopies, you've had the testing done, they don't find anything. And often pelvic floor therapy for constipation is overlooked by our providers. So just know that if you listen to this, that you're like, yep, that's me or that's a family member, maybe have them go see a pelvic floor PT or even set up some sort of virtual where, gosh, even a solid conversation with somebody about constipation can be helpful, because often it's like a secondary issue people have when they come in. And after we just go through like the anatomy of it all, their mind's blown, give them a couple things to work on, and they finally start pooping again. So,
well, it's just this funny because, if your ankle hurts or something and you stop doing what you're doing, or you just take it easy, at the end of the day, we have to poop. Like we can't avoid the inevitable. So this is a very satisfying and gratifying thing to help people do better with.
Because pooping should be satisfying.
That's very true. Very true. Yeah. Okay. So I will dive in then to just a little bit of anatomy, and Megan and I could geek out on this all day long. We're going to try to not bore you, but just to help you understand your body a little bit more and understand what's actually happening during a bowel movement. And so if we think about the pelvic floor, and if you've ever looked at a picture of the pelvic floor, it's a whole group of muscles. And so a lot of them start on the front of our pelvis and go clear back to the tailbone. And so they're passing the urethra where you pee out of, they're passing your vaginal canal, or not if you're a male. And then they're passing by the anorectal canal where your poop comes out, and then they're hooking onto the tailbone. That's just a big majority of them. And so when we have trouble right there, a lot of times that it's a muscular issue. And so that's how Megan talked about, if the GI, if they've done all the tests and you look great, your digestive system might be just clicking and happy and perfectly fine. But then when it gets to the opening is when we're seeing trouble. And so there's one specific muscle that we tend to really see as a major player and a culprit in this. And it's a big word. Don't be alarmed. Don't be afraid. It's called the puborectalis. And so it goes from our pubic bone up front, kind of by where we pee, and it loops around. It's like a slingshot. If you can imagine this muscle looping around the canal that your poop comes out of. And so it's really great in helping us hold our poop. But then when it's really tight, it pinches that sucker down, and it makes it to where you have to strain and push and hold your breath or whatever you're doing, grip, and force that bowel out and force that muscle into stretch in order for that poop to pass by it and get out of your body.
And I know when I first got into pelvic health and learned that, I was like, oh my gosh, mind blown. And so then when you show people that, they're like, oh, and to know that when you're in doing pelvic floor work and let's say we're doing internal work vaginally, we're working on releasing those muscles and working on allowing for more mobility, it naturally just makes your bowel movements easier because that's what one of those muscles is, that muscle. So it's not like we have to do something extra special to like get that piece of it. We're doing it anyway. And yeah, so I mean, gosh, just right. I mean, all I think about is like if you're a glute clencher, like man, you're got that sucker nice. And there was a joke going around on Instagram. I don't know if you saw it, Roxy. I had shared it. I was actually going to pull it up to see. I can't remember who it was, the handle that we shared, because I want to give her credit, but it was like a joke about puborectalis. It said something like what the puborectalis, or I don't know, something like what the pelvic floor say to the puborectalis. And it was like, you got to loosen up and let that shit go.
Yeah, seriously though.
You really do. That muscle's got to loosen
but it's
up.
so serious. It's like we're 100% serious while we're laughing. And so I think too, if we imagine those muscles are the muscles of our pelvic floor very rarely are just isolated where one is the problem, right? So this guy, then this muscle we're talking about, this puborectalis, it's a big player in constipation. But also then if it's tight and it's not working well, then the muscles around it aren't. The sphincter's probably not. Like it just throws off the whole system of how much those muscles know how much to squeeze, and then how much they're supposed to relax just while you're chilling, and then how much they're supposed to relax when you have a bowel movement. And so it just throws off what those muscles are doing. They don't have a home base. They don't have anywhere to kind of land and just go and work from. And so we've called this guy out, this muscle out by name, but, but I mean, it's not just that muscle. Usually it's just the leader of the pack almost that's causing this problem.
Okay. Here's a word that I always think is so funny to say: proctalgia fugax. I don't even know if I said it right. Hello, I'm a pelvic floor therapist.
Pronunciation doesn't have to be our strong suit, right?
I know. But this is a spasm of your rectal muscles, like pain at your rectum. And I think a lot of people experience this and they don't know what that is. And again, pelvic floor dysfunction, that's a muscle. And that is something that we work on. And quite honestly, that can be something that we can improve pretty quickly. So, but then there's just things too, like ileocecal valve dysfunction. And that's the little sphincter muscle that is situated at the junction between where the small intestine and the large intestine connect. And so like if that has an issue, you can have trouble with like allowing food to digestive food to move past. So now we're moving like beyond pelvic floor. We're kind of going back into like, okay, here we are. Now we're trying to make it around the colon to get to the pelvic floor. So that's something we can address. We can help with motility. There's something called bowel massage that we like to work on with people. And again, we find so much tension and restriction in the abdominal wall. That's something that we work on in breath work and all the things. So yeah, really, as we kind of went through the anatomy, but also just thinking too about those other structures that can be playing a role and allowing the bowel to even get to where it's going. Yeah. So I guess with that too, I just talked about like slow motility. Another thing that people don't realize is you can poop every single day and still be constipated. You do not necessarily, if you're not evacuating all the way, you never feel like you're empty all the way. or maybe it has become so common for you to not fully evacuate that then you don't even realize that you're not. That bowel just sits there and the borders of the rectum can kind of expand and stretch. And so then we can run into things like fecal leaking. And that can be that maybe you're constipated and we have more of like a watery stool behind it that leaks through it. And again, this isn't like doomsday, but if you're like, oh my gosh, that's me, we're just pointing out the fact that a lot of these things that are often put into like, that's just normal, you're going to have to live with that. That's IBS, is actually can be treated through pelvic floor therapy. So, and then like if you have a rectocele, it's hard to talk too much about this without having a visual in front of somebody. But if you have a little prolapse per se in the rectum, it causes a little pouch and bowel gets stuck in there. And so then when you have your bowel movement, it doesn't come all the way out. And so you have a little bit sitting there, and then that might be things that you're wiping all the time, or you don't feel like you're quite evacuating all the way. So a lot of things are going to affect how you have your bowel movement.
And I think too, just to kind of add to that, you talked about just some things that were happening even deeper into the digestive system. And it is very possible for someone to have IBS. We're not throwing IBS under the bus completely. Sure. So I think if someone is hearing what we're saying and thinking, oh my goodness, I have pelvic floor dysfunction, every diagnosis I've had is all wrong. That's not at all what we're saying. Yeah. There's very much this can be a combination of multiple things. And I think a lot of times with just different diagnoses that happen in our body, they're very isolated diagnoses. And usually with pelvic floor, that can come along with several diagnoses. Does that make sense? Of yes. Like you could have IBS, you can have like a slower motility, you could have rectal spasms, you can have constipation. All those things can actually function together. And then what we come in and do, or we are looking then at how is the musculoskeletal system feeding those diagnoses or pulling, decreasing the symptoms of those diagnoses. And so I don't want us to come in and feel like make anyone think we can save the world and cure all constipation just by addressing the pelvic floor. But if there's constipation, if there's GI issues, I can confidently say 99% chance that there's also pelvic floor dysfunction that's happening alongside that.
Yep. Boom. Mic drop. Okay. So let's talk about some things we can do to give everybody a little bit of some takeaways of what they can do if they might be dealing with some constipation, and some things to think about, some tips. So let's start with nutrition. We would say, eat regularly and explore. We're not going to get into the nitty gritty of it because that's not what we're here for. Normally, if we have some major things that I think need to be addressed, I definitely refer out to like functional nutritionists. But eat regularly, try new things, obviously try to increase your fiber with that. So 25, 35 grams of fiber is typically recommended, but a lot of times people that come in with this are already eating pretty good and like getting the amount of fiber, and sometimes increasing or like supplementing with fiber causes other GI issues. And so we definitely don't want the biggest takeaway from this to be like, it's what you're eating, because often like it's just such a small piece of it. Now, given, if you're eating a crap diet and never getting anything to bulk up, then we need to talk about it. But again, that's just that's a low-lying fruit here. So we want to say it. So eat regularly, explore foods, fiber, that sort of thing is something to look at.
Let's jump into then talking about a routine or the consistency of how often that you're going. The standard is 3 times a week to 3 times a day. Like there's a lot of range in between that. And so, but we want that to be pretty consistent throughout our life. So if you're used to pooping every morning, and then all of a sudden you don't poop for 3 days, then that's not great, or if you're a 2-timer a day and then all of a sudden you're, are stopped up, that's what we look at. Or if you, one day you poop twice and then you skip 3 days and then we don't want this all over, this teeter-totter effect of unpredictability. Our body really likes that routine. It really likes predictability with that. And so if you're kind of all over the board, or if you're outside those norms, if you're going 8 times a day or you're going once a week, then, those extremes are really, those are the red flags we're looking for. Now, Megan already talked about if you poop once a day, you can still be constipated. So it's not just the frequency. It's not just how routine your body is. There's more things we look at with that if there's symptoms alongside that. But definitely our body wants to have that rhythm. We're all created uniquely. And so you don't compare yourself necessarily to the person next to you, because your GI system or your digestive system might just have a better rhythm that might be a smidge slower or faster than the person next to you.
Yeah. I mean, technically, they say like historically it should be, it's like you have a meal and you go and walk and then you poop. And so that would be, 3 times a day. But that doesn't happen. And I think that sometimes we get people that are like, oh my gosh, my child or whoever, they poop multiple times a day. Like, what's wrong with them? Like, no, they have a really good system. So, I mean, so diarrhea is that, if it's a solid stool, great, good. Our bodies do, like Roxy said, just echoing that. If you're somebody, it's like, yep, every morning I get up and I do this and then I poop and then I go. That's it. That's fantastic. And a lot of times with kids, that's what we like to work on, is kind of like getting up and drinking something warm and allowing time and try to get into a routine to get the body to like have it happen kind of consistently at the same time. So, yep. And then I'd say probably our next tip is if you need to go, go. So have it doing the whole, like, I'm going to hold it until later and then I'll go. Yeah, you can get by with that every now and again, but like, don't make that a habit. And that is something I have to tell my kids all the time because they have fallen into the whole, like, they want to wait until they come home and they'll hold it all day long. And I'm like, listen, when you need to go, go. Do not make those muscles just sit and hold it. So that is another one of the tips that we like to give to somebody. Roxy, why don't you talk to us about positioning?
Sure. So has everyone heard of the squatty potty?
Yeah. If you haven't.
Shameless plug here. But there's also off-brand ones on Amazon for $15. So we're not getting sponsored by Squatty Potty. Although if Squatty Potty, you want to sponsor us, we'd love to have you.
Squatty Potty. Yes. We will push for sure.
Yes. We'll toot that horn all day, every day. But basically, the idea of propping your feet up and the way that our hips can be positioned where they're bent and wide and spread wide, that just helps. That sets the pelvic floor up in a way that it promotes that to relax. It's harder for the pelvic floor to stay really tight and clenched if it's in that position. And the squatty potty just sets you up for that. If you have a stool, you can use that. There's little hacks. Like if you're traveling, you can put your feet up on some toilet paper rolls. There's just different things you can obviously do. You don't have to go buy something jazzy. But the idea of putting your hips in a way that facilitates relaxation, that then so that when you get into that position, your body knows, oh, here we go. Now it's time, and also breathing and relaxing and sometimes scanning your body of saying if you're tense in your legs or if your toes are raised up, if your toilet seat is too high and your toes are raised up, then that's going to tense your calves, which then is also going to tense your pelvic floor. And so getting into a position and recognizing that that's actually effective. I think some people think I'm crazy when I, really recommend that, but it's evidence-based. It's anatomical. You think about even probably back in the pioneer days or whatever, people were squatting all the time. You know what I mean?
Yes.
Like you just think about really primitive settings of just that deep squat. And that's essentially what the squatty potty does, or what we're promoting, of just getting our body in that position that promotes ideal pooping.
Yes. I know I think early on, Squatty Potty's done such a great job with their advertising actually, and like showing why and positioning. And I think a lot of people were kind of like, oh, is this for real? So I know sometimes I'll get people who are like, oh, I've always seen those. I didn't know if that was actually legit. And it is. And the position is very helpful. And especially if you have high toilets, which it can be very helpful, like an aging population, because you can get off the toilet easier. Like you can stand up off the toilet easier. But sometimes those higher toilets, it's hard because then it puts the legs in a poor position. And also if you have little kids and they're sitting on the toilet with like the little seat and their feet are dangling, try pooping with your feet dangling. It's hard. So put something underneath their feet. And a lot of times, I mean, I didn't even know this stuff when my kids were little, like their feet dangled, but now I'm like, always like, put something underneath their feet. Like you try pooping with your feet dangling. Okay. So take your time. That is our next one. Sorry, I said that's kind of like, because I slept funny last night. I'm about to turn 40. Okay. I slept funny last night and I turned my head a certain way and I'm like, get a jab down on my shoulder blade.
Don't you know a PT that can help
I know.
you with that?
See, like even us, we have issues. I can't wait. I actually have a PT appointment on Monday with Dr. Abby at the clinic. She'll fix me. So anyway, the next tip we have is take your time. So this is huge. We run into people all the time. Either they're rushing to pee or they're also rushing to poop. So sitting down and like straining and bearing down and trying to push the poop out as fast as you can, not a good idea. If you are constipated and you're sitting there straining, that's going to lead to possibly like hemorrhoids, fissures, that sort of thing. Okay. So yeah. So taking your time, and obviously on the flip side of that, it's actually not great for you to sit on the toilet for, 20, 30 minutes, especially if you can't go and you're constipated. It's better to just sit down, try to go, breathe. And these are all things like the techniques that we're talking about. That's something that we teach in pelvic floor therapy. There's different things we can do. So that's like a whole nother thing. But anyway, so you go through your techniques, all the stuff. And after you've been sitting there for, 10 minutes or so, if nothing's happening, might have you get up, move around, sit back down. And, if you sit for 20 or 30 minutes, your butt's going to go numb. And actually you end up like, especially if you're constipated and you've been sitting there straining forever and ever, the rectum itself, you just get really uncomfortable. I have to sometimes talk to my son about that. He'll be sitting and it's like in the summer if we're on vacation, he gets backed up or constipated. And I'm like, buddy, like we got to get off, move around, like we'll try again. So anyway, but the taking your time is big. And just relaxing. It should not be a stressful event. And if it is a stressful event, that's when, just get some help. So, all right, let's move on into
Magnesium.
Yeah. All sorts of good magnesiums. We're not here to tell you which one to take, but
okay. So magnesium is a regular recommendation that we tend to make. And again, we're not here to give you
medical advice.
Medical advice, recommendations. If, this is definitely something you want to consult with doctor, whoever is leading your supplements or your medications. But magnesium it is a very effective natural strategy to use to help soften your stools and keep the motility moving and help just ease the bowel movements that
Keep
way.
the flow going. Yep. I take it every night. And when I travel, I have to increase it. Roxy and I went on this business retreat back in, April. We were in California and we stayed in an Airbnb it was us and 4 other pelvic floor therapists. And one night we had all hit our max of like, we had constipation and everybody was like grumpy because nobody could poop. So we all just like laid in the living room and did bowel massage to each other, which by this way, bowel massage is not an internal thing. I think when we say that, people are like, what? It's through the abdomen. And so we were like, working on each other, ileocecal valve release stuff. And we were just like cracking up because and then sure enough, got us all going. So
I didn't ever think about that. Does sound not what it probably is.
I know.
Picture what it is when I say bowel massage. And
I know it's lovely, but I think sometimes people get scared. I'm like, no. It's great.
Gosh, I think my eyes have been opened to probably what my patients are staring at me. What are you talking about, lady? Or what are you about to do to me? It's probably what they're thinking.
Exactly. I know. I think they're scared. But yeah, so magnesium is always great. And then of course we really talk a ton about hydration and water. That is so huge of just if you're dehydrated, your bowels you're going to have more difficulty and bowels are going to be dehydrated. So water. And then we also talk a lot about electrolytes. and typically like guide people on maybe some options to take. But just it's that balance of getting our magnesium and our potassium and our sodium and our water. We really are deficient in a lot of those often. And so we like to add in the electrolyte piece to the water, because if you're drinking a lot of water, you run the risk of potentially like kind of flushing your system a bit. And then that can lead to other things. So, and again, but then there's these, there's outliers. Like if you're having, that's why, again, we're not giving any sort of medical advice through this podcast, because we want to make sure and look at your medical history and all that kind of stuff. Like if you're somebody who's swelling all the time, we're not going to tell you to take an electrolyte that has a whole bunch of salt in it, that you're on some sort of like low salt diet. So stuff like that we like to look at. But that pretty much is a list of some things that you can look at. So reviewing is thinking about like our nutrition and what we're eating. When you need to go, take your time, try to get on a routine, think about the positioning while you poop. And there's other things too. You hear a lot about like warm drinks in the morning, like warm lemon water. Sometimes coffee is used to help with bowel movements. But ultimately, hopefully, after listening to this podcast, you understand a little bit more about constipation and how the role of the pelvic floor plays into that, how it can be that contributing factor. It's, again, with this stuff, guys, it's always multifactorial. And we are just here to help uncover root cause of things. And if you are just been given just a medication and not really feeling like you've had a lot of answers, hopefully this podcast helps that and maybe can lead you to a provider that can look a little bit deeper. So, Roxy, you got any other words of wisdom about constipation?
Nope. I think that was a good, I think that's a good rundown. We could go on, and I don't think you want me to do that. I could, yeah.
We'll stop now.
Yeah, we'll stop now, but shoot us questions, or let us know if you have any questions on anything. If any of this was surprising to you, or light bulbs went off in your head, that's really, we're wanting to bring understanding about constipation in this little nugget of a episode.
Yeah, which is the whole purpose of this podcast, really, is just to allow people to get educated if they're not able to get in to see a pelvic floor therapist. But thanks for listening, guys. And like Roxy said, if you got questions right now, probably the best way to do that is through our social media page, which is at the Pelvis Project. Like, follow, share, download, all the things. All right. Until next time, we will be back in a few weeks. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.